Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Treatment options for hearing loss. Hearing loss is a common condition that affects hearing, communication, and social skills. Treatment options for hearing loss may be as simple as removing excess earwax, treating underlying conditions, such as fluid in the ear, or using a hearing aid. More complicated options include surgery or cochlear implants. /r/n/r/n read on to learn more about treatment options for hearing loss. /r/n/r/n/Verywell, Laura Porterrnrn/r/n/r/n The underlying cause and type of hearing loss you have will dictate whether it can be cured. /r/n/r/n Conductive hearing loss, which is often caused by excessive earwax or fluid in the ear, can often be cured. /r/n/r/n The other main type of hearing loss, sensorineural hearing loss, is usually the result of a problem with the cochlea, or auditory nerve, and is more likely to be permanent. /r/n/r/n In the United States, 13% of people over age 12 have some degree of hearing loss in both ears. The incidence of hearing loss is even greater in older adults. Around 25% of individuals over age 65 and 50% of individuals over age 75 have debilitating hearing loss. /r/n/r/n There are many methods to remove earwax, but not all are safe. /r/n/r/n If you want to try to remove earwax at home, there are over-the-counter, OTC, removal drops that are safe for individuals who have not had ear surgery. /r/n/r/n You should not use cotton swabs or stick foreign objects such as paper clips into your ear in an effort to remove wax. The practice of ear candlingplacing a lighted hollow candle into the ear canal to suction out earwax is also discouraged. /r/n/r/n If you have enough excess earwax to diminish your hearing, you may have a blockage. If so, it's best to have it treated by a healthcare provider. They usually remove earwax with special tools like curettes, small scraping tools. /r/n/r/n Hearing aids are devices that amplify sound. They are worn either behind the ear or just inside the outer ear canal. They are a good option for individuals with more permanent types of hearing loss. /r/n/r/n To get a hearing aid, you can visit a healthcare provider such as an audiologist, who will evaluate your hearing and recommend an appropriate device. Over-the-counter hearing aids are also available for adults with mild to moderate hearing loss. /r/n/r/n Hearing aids come in many styles, including with features like Bluetooth. These devices continue to improve in functionality. /r/n/r/n Surgery may be performed for conductive hearing loss. For example, if your hearing loss is caused by fluid in the ear, surgically implanting a ventilation tube in the auditory tube will open it up so that the fluid can drain out. /r/n/r/n Otosclerosis, which is a condition of abnormal bone growth inside the ear, causes damage to the tiny bones in the ear necessary for hearing. This condition is another cause of hearing loss that can be surgically treated. The bones can be removed to improve hearing. /r/n/r/n Surgery may also be necessary to remove growths in the ear, such as acoustic neuromas, which can impair hearing. There are also special types of hearing aids that are surgically implanted. /r/n/r/n Installing cochlear implants is a common surgical procedure to treat hearing loss. /r/n/r/n A cochlear implant is a device that stimulates the cochlear nerve. It is only recommended for people whose sensorineural hearing loss cannot be helped with a traditional hearing aid. It consists of multiple parts. /r/n/r/n A cochlear implant will gradually allow you to better understand speech, but most people need to undergo rehabilitation to get the most out of their cochlear implant. /r/n/r/n Not all types of hearing loss can be prevented. /r/n/r/n. However, one of the most common types of hearing loss, noise-induced hearing loss, can be prevented. Sounds that reach 85 decibels or more can damage your hearing. Activities that can expose you to this level of noise include /r/n/r/n. The longer you are exposed to loud noise, the more likely you are to suffer noise-induced hearing loss. Therefore, you should limit the amount of time you are exposed and, when necessary, wear proper ear protection, such as ear plugs. /r/n/r/n. You can also protect your hearing by avoiding medications that are known to cause hearing loss and by seeking prompt treatment for ear problems, such as ear infections or fluid in the ear. /r/n/r/n. Sudden hearing loss should be immediately evaluated by a healthcare provider. /r/n/r/n. The best treatment for hearing loss depends on multiple factors that are unique to an individual's circumstances. A patient will need to work with their healthcare provider or an audiologist to develop a treatment plan that best suits their individual needs. Common treatment options include hearing aids, earwax removal, implants, or surgery. /r/n/r/n. Hearing loss is not only frustrating, it can be socially isolating and lead to depression, anxiety, and even cognitive decline. Early and adequate treatment may prevent further hearing loss, as well as the psychological problems associated with it. Improving your communication and social skills through treatment will improve your quality of life. /r/n/r/n. If you are suffering from an incurable form of hearing loss, other options exist to improve your communication skills. These include working with a speech therapist, learning sign language or lip reading, and using advanced technological devices to improve communication. /r/n/r/n. Research shows that hearing loss is common, more likely to occur in individuals of advanced age, and can lead to social isolation, mental health challenges, and cognitive problems. Research also shows that adequate treatment can minimize the harmful effects of hearing loss. /r/n/r/n. Hearing loss can be genetic and present at birth, or it can be the result of health conditions, such as fluid in the ear. The natural aging process and exposure to loud noises over time can also cause hearing loss. /r/n/r/n. Hearing loss that only affects one ear is more likely to be due to an underlying medical condition, such as fluid in the ear, an ear infection, excessive earwax, cholesteatoma, or Meniere's disease. /r/n/r/n. It depends on where you live. In the United States, being legally deaf is defined by individual states. Many states consider legally deaf to be a hearing loss of 70 or more decibels, with an ability to understand speech at 50% or less with hearing aids. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.